Well, another pandemic could be on the cards as antimicrobial resistance is set to soar over the next few decades. New research from the Australian Medical Association warns about its existential threat to human health. But many Aussies don't even know where to start when it comes to the science. To dig deeper, AMA President Dr. Danielle McMullen joins us live in Brisbane. Morning. What are we getting wrong when it comes to antibiotics?
Well, it is surprising still, despite a recent viral pandemic, how many people don't understand the difference between a bacterial and a viral infection, with more than 90% of adults not understanding the difference, and that antibiotics simply don't work for a viral infection, and yet Australia is one of the greatest users of antibiotics, and that is contributing to this real severe problem we're starting to see with resistance to antibiotics, and it could leave us in a dire state in not very many years.
Well, hang on, we're not prescribing ourselves. The doctors are giving them to us, so is it the doctor's fault?
Yeah, look, so we do have to act at all levels in not just human health, also agriculture and animal health. But in that human health space, it's responsibility of all of us. Yes, doctors need to be strict with when we prescribe antibiotics, and patients need to be ready for that story. Because I know in my clinic, it's always a much more difficult conversation to say no than to write the script. Now, we certainly need to, be talking more about the difference in infections, and it's one of the reasons we need better funding for general practice to have those longer discussions and explain why having a script isn't the better answer. And we also need governments to be strict on this as well and stop the expansion of who can prescribe antibiotics, and make sure that it really is a discussion between a doctor and a patient about what is the best treatment. It might seem like a simple infection, but over-treating those could mean that in as few as 25 years, these simple infections could be deadly.
Wow, OK. So take no as the answer, people, when the doctor says it. Thank you very much. Here's Shervo.